Hey, hey, hey. Welcome, you guys. I know y'all got nervous because it's 1:09 and we hadn't started yet. So we want to make sure that everybody was able to view the video and everybody was able to come in. So I am so excited to be with you guys today. I've had a pretty good long break in between sessions and in between semesters. And so we have been putting our heads together at Ivy League and figuring out all these different new and exciting things to offer for you guys for this semester. So I am beyond pumped to be with y'all today. I'm refreshed, and I slept and I showered and I did like all these really great things that we don't always get to do when we're busy teaching and learning and in nursing school and things like that. So I'm super excited to be with you guys today. We have some awesome test taking strategies for you. And then next week, we're going to come back and kind of do a two-parter because so many people wanted to talk about test-taking strategies. Today, my main focus is going to be talking about different test-taking strategies you can use just across the board for no matter what exam you're going to take. I also really want to focus today on priority questions. People struggle with those so hard, so we're going to talk about those today too. I want you guys, as you're kind of coming into the session, the live feed, to tell me kind of who you are and where you're from and what nursing school you're coming from and what semester that you're in, or kind of how far you are into the program, so I know how advanced to make the questions today. I'm going to hit you guys with some pretty difficult questions today in order to practice the test taking strategies that we're learning. So I think these are probably the hardest questions I've ever written. I used some of them for our NCLEX prep. And so they're tough. They're tough. So if you guys are very new in nursing school, you may be like, whoa, but it's still going to help you a whole lot. Okay. So I'm going to go ahead and I'm live streaming from a couple of different places. So I want to make sure that we're all up and running, and I'm going to turn down the volume here just a little bit. All right. So I have about 100,000 different things I want to talk to y'all about today. One thing, I'm from Texas. I talk super, super fast. I say y'all a lot. I believe students in the past have accused me of being on crack. I'm not. I'm just really happy with my life, and I like to talk really fast. And so if there's something that you missed, we're going to download the video onto our Facebook site. And you guys will be able to watch this as many times as you want to. All right. So I see people are starting to come in. We've got Crystal's here from Jamestown Community College. I think I've seen that college before, so you guys must have some students that come here. We've got Brittany coming in. She's starting on the 17th, and Megan from Lincoln University. It's your last semester. Congratulations, Megan. That is awesome. That's a huge feat to have accomplished. So we have people coming in. I want you guys to just kind of tell me where you're from. And that way I kind of have an idea, and I'm seeing some familiar faces in here too. I think I see some of our students that are joining us. So for those of you who don't know, I just want to let you know who I am and what we do here. So my name is Amber Brown, and I'm the owner of Ivy League Tutoring. We're a tutoring school for nursing students. We not only see nursing students, but just as of this semester, we're starting to see students who are even prepping for nursing school. So we have a HESI A2 prep course that we are actually rolling out on Thursday. It'll be our first one, and we're super excited. So if you have any friends that are trying to get into nursing school and they're taking the HESI A2 entrance exam, we have the prep course for them. You guys can either come here in person. We're located in League City, Texas, which is outside of Houston, or you can join us anywhere in the world on Facebook Live. So if you have anybody that's prepping, definitely send them on over our way and we'll get them prepped and ready. All right, I see Lisa's here. Oh, Jennifer Robinson recommended. Oh, that's awesome. I absolutely love her, and I worked with her in pediatrics at UTMB, so that's fabulous. And I see Jacqueline's in here. She's coming in her last semester of the ADN program. That is amazing. What a huge feat for you guys. So it's looking like everybody's kind of in different places. And so the test taking stuff that we talked to you about today can help you, not only if you're going in as a first semester student and haven't taken an exam yet, or you're going and you're sitting for your NCLEX in a couple of weeks. It's going to help you regardless. All right. So I want you guys to come in, keep telling me where you're from. I love seeing you guys from all over the United States and from all over the world. That really excites us. So I want to talk to you guys quickly about some new and upcoming big things that we have planned for y'all this semester in order to help you learn all the things. So our main goal here at Ivy League Tutoring is to make sure that you are learning things, that you're learning it in a really dynamic and a really fun way. We don't do anything boring here. I get up, I jump around a lot, I sweat a lot, I say curse words sometimes just because it happens, and I'm a Texas Southern girl. And so we like to have fun here, and we want to make sure that what you're learning it in a fun way. You know, a lot lot of research has shown that if people are excited about what they're learning and it's fun, you're going to retain it a whole lot better than reading out of an ATI book or, reading out of a textbook. That's boring and you don't retain that. So our job here is to make sure that we have different sessions for you that are going to make you learn in a really amazing kind of way so that you can retain it, you can learn it, and you won't forget it. All right. You guys have studied for exams before where you've studied, you do marginally on the exam and then you come to a final exam and you remember nothing. So we don't want to do that here. Our goal here is to make sure that you learn it and that you retain it and it becomes a part of you. So that's one of the biggest things that we wanted to offer for you guys. One of our biggest missions here. So in order to do that, all right, so we've got 1,000 different exciting things for you. All right, the first thing I want to quickly mention to you guys, we do have a text service. So we will send out promo codes and discount codes and giveaways and study tips and things like that through our text messaging feature. So if you haven't opted in, or even if you have, we're kind of starting over on the text messaging with a different kind of a format. So I want you guys to opt in today. If you have your cell phones, which most of you are probably streaming off of it today, you're going to text nursing, NURSING, to 85100. You will text nursing to 85100, and that will opt you into our texting. Even if you have opted in before, we need you to do it again, okay? Because we are starting over in a new format. So nursing, I'm gonna say it one more time, NURSING to 85100. We have already lots of discounted prices. We wanna make sure we're offering this education to you at the most affordable price because y'all, I have been a nursing student multiple times in different degrees, and I've eaten the ramen noodles, and I've walked really loud to the kitchen to get the mice out of the kitchen before I got there because gross, so I have been a broke nursing student and I get it. So we are doing our best to provide this for you at the most affordable price. We have a lot of discounts that we offer. So once a week we post those and let you know, hey, if you give us a review on Facebook, that's $5 off your next session. Do a Google review, $5 off your next session. So there's lots of ways that you can basically get your tutoring for free. And we offer tutoring for pretty much everything. So text service is one way that you guys can get some promo codes. So get in on that. The new biggest thing that we're rolling out right now is our videos on demand. We rolled those out yesterday and we are superbly excited. So what those look like is you go to our normal booking system and we have recorded, I think about 40 videos so far that we recorded last semester. Some of them are just one-on-one with me and I'm talking to the camera and I'm walking you through insulin or I'm walking you through congestive heart failure. And it's just me and you and it's like a kind of personalized individual session. Some of them are group sessions where we have 10, 15 people in here and the dynamics get kind of exciting. Oh, Kelly, real quick, I see you need help with Select All That Apply. Girl, we got you. Because next week, this free session is going to be just on Select All That Apply, and that's it. So make sure you tune in for our free event next week. Today will be mostly priority. Next week, Select All That Apply. So our videos on demand. So what you'll do is you can just go to our booking site. You can purchase whatever it is that you want. Let's say on your exam, you're just having stroke or stroke is part of your exam. You can go and just purchase the stroke video. We'll send you the link to watch that. We have 1 hour, 2 hour, and 4 hour reviews. Our 4 hour reviews are mostly our ATI and HESI reviews. So if you guys are studying for an ATI or a HESI comp, an exit exam, an end of semester exam, we have that for almost every session. We have OB, we have PEDS, we have mental health, community health. We have everything for you in these big giant reviews so you can get everything that you need, the most testable information on ATI and on HESI. Okay, so we have those as 4 hour reviews. I'm so excited, I can't. Okay. We have 2 hour reviews that are on like congestive heart failure or the whole cardiac system or psych pharmacology. So we've basically collected from you guys the things that you want to hear most, the things that you struggle with the most, the things that you're like, okay, I've read this 80,000 times and I still don't get it. And now we've offered those as videos on demand. So those are for you and you can have access to those for up to 14 days once you purchase it. Go and look at them, take a look and see. And we have free videos for you guys too. So if you go to our YouTube channel, and I'll post a link after we're done here, on our YouTube channel, we have free videos for you, right? Because we get it. And so some people just need some things that are just free. So go check those out. And that's what you can expect from our videos on demand is that quick, that fast pace, that picking your brain, that non-passive learning. We do not do passive learning here. Okay. So y'all can kind of see how we teach. And if it's something that you're like, man, I really learn that way, then you can go and purchase the videos on demand that you need, get exactly what you need. There's no hidden fees, so we don't charge your credit card for month to month. You don't need to sign on with us for a year. You just go in, get what you need, and then that's it. Okay, so We have those available on our booking system. We just wrapped up our NCLEX prep course, and so we'll be doing another one of those in April. Everybody's been asking when our next one is. So our next big, giant 2-day NCLEX prep course review will be in April, so you guys just keep that in mind. We'll be rolling out dates pretty soon for that. And then right now we have Facebook Live sessions going on. They start tonight. So tonight we have my first one for the semester is pediatrics, growth and development, family-centered care, pain, and physical assessment. So we're covering all of that in 1 2-hour session. And every session you guys see on our booking system can be booked anywhere in the entire world, okay? Because we put them on Facebook Live. You can watch just like you're watching here. We'll be up at the board. We'll be doing videos. We'll be doing all kinds of things to help you learn. So anything that you see in our booking system, you absolutely can book and live stream from anywhere. And even if you can't live stream with us, let's say you're in clinical when I'm going live tonight, then we download that video onto the Facebook Live page. You can watch it for 14 days as many times as you want to, so you won't miss out on anything. All right. So we have lots and lots and lots of things for you to plug in to make sure that you are learning nursing school in the most amazing way possible. We make a lot of jokes. We say a lot of things that are probably not okay, but you'll get it and it's funny, and we love Grey's Anatomy. So there's lots of those references too. All right, so just to recap really quick how you can plug in for this semester, get on our text service, text nursing to 85100. We've got our videos on demand on our booking page. We have all of our Facebook Live sessions are up and ready to go. We've got our NCLEX prep course coming in April, and then subscribe to our YouTube channel so you can get all our free videos, okay? And this one we will be uploading to YouTube as well, so you can have some test taking strategies, all right? So as you guys are in here, I want you to tell me kind of what your biggest struggles are with test taking. Everybody always wants to come to the test taking strategy sessions, and I want to hear what your biggest challenges are. Where do you get stuck? Like, I know some people say that priority is a big issue, you know, trying to decide what is the most important or the most right or the most orange of the oranges, okay? And that can be a struggle in nursing school, is they write these test questions to where you're having to pick the bluest of the blues, and that can be difficult. And so that's going to be our main focus today, is priority questions. Dorothy, I see you want select all that apply. Lots of people are asking about that, and we will be doing that one as a free Facebook Live next Monday, same time, okay? So select all that apply will be the focus for next week, all right? So what I want to start out with you guys in test taking strategies is talking a little bit about you first, okay? Because what I've seen students do is, you know, they come in here and they are worn out and they are tired and they cry, and Lord, you guys have a lot on you right now. You've got families to take care of, and you've got parents that are expecting certain grades from you, and you've got assignments, and you have tests, and it's a lot. And we want you to know that we get that and we understand that, and that's a heavy load. And that's why a lot of people don't make it through nursing school, is that is just a lot of pressure on people. And so that can really take a toll on your test taking, and people don't talk about that. But, you know, somebody gave me an analogy one time, and I always wondered this when I was in an airplane. You know how they always tell you if there's a kid next to you or you brought your child with you and there's some turbulence in the plane and the masks fall down from the top of the airplane, right? So there's turbulence and everything's kind of going crazy, and the masks fall down and they have oxygen that are going through those masks. They say put it on yourself first and then put it on your child. I judged the hell out of these people, and I'm like, I will always take care of my child first. And you would think that that's the case. So you think, I need to take care of my studies first and my family first, and I need to do all those things first. But what I realized is that if you do not have the oxygen that you need, you will pass out. And there is no way that you will be able to take care of the child that is with you and be able to make sure that that child is taken care of. So self-care is so incredibly important. Do y'all hear me? Self-care is important. It is not selfish. It is not looking out for number one, it's just you, but really you have got to take care of yourselves, okay? We neglect working out, we neglect eating well, and it's hard to when you're in the hospital, and I get that, okay? But self-care is superbly important. Y'all have got to take care of you. So with that said, pulling all-nighters is probably one of the worst things that you can do for test taking. Okay, it is one of the worst things because your brain becomes so tired and it's just desperately looking for fuel. You almost get in like a confused state. Okay, so your brain will say like, okay, I'm basically like deprived of oxygen, I'm deprived of sleep. And you'll go into this almost like a psychotic kind of thing. And you'll see that when you go to your test reviews and you start looking at your exam and they show you what you did wrong and you're like, I Literally cannot believe I put that. That was the stupidest answer. I knew that wasn't it. But your brain is so tired that it just chose whatever was right in front of it. So all-nighters have got to go. That serves nobody. You will do much better on the exam if you have slept and if your brain is fresh and ready to go, even if you have less content under your belt. You can try to shove all the content in your brain that you want to, but if it's tired, it has a very hard time differentiating and figuring out where that content goes. Sleep, okay? So you need to set a time for yourself that you're gonna go to sleep that evening, the night before the exam. The other thing is to eat a good breakfast. We skip meals all the time. One, because we were poor, all right? So I remember being poor and being like, okay, what student organization can I join so I can get free pizza day? I joined a lot of those and a lot of organizations that I was like, they look at me like, you don't belong here. But I was hungry. So I get that, but it's really important for you to eat breakfast that morning. You've got to fuel your brain. You guys know as nursing students, the brain is the big thing that your body is always trying to maintain homeostasis with, right? Let's say your body even goes into shock. Right? When your body goes into shock, it's going to shunt blood away from your arms, your legs, your kidneys, your gut, your liver. It's going to start shunting blood away from those to maintain brain, right? Brain is the biggest thing that your body is meant to protect, right? So it's so super important for you to feed your brain. If it's starving, it's going to make bad decisions. You guys have okay? So you need to eat something that's high in protein, something that's going to give you some carbs for a period of time. Do not have pancakes and syrup and let that be it, because you will have a crash and it will hurt you. All right. So get some sleep, take care of yourself, eat breakfast the next morning. All right. The next thing I want to talk to you guys about is if you have anything that can impede your test taking. And what I mean by that, do you have severe test anxiety? Do you have ADHD or ADD? Y'all, if you have those things, it is possible to do beautifully in nursing school, and it is possible to be an amazing nurse. If you have test anxiety, if you have anxiety, if you have depression, whatever those things are, it is still possible for you to be a ridiculously amazing nurse. Do you hear me? However, it is very imperative that you take care of those issues before you test take, okay? So if you have ADHD and every person that's going and swallowing or or coughing, and it's just like driving you to the point of insanity, or you see it and people are getting up and that drives you crazy, you guys, you've got to get this taken care of. Go to your school and most of them will allow you to do modifications. It is not a sign of weakness. Do you hear me? It is not a sign of weakness to get help. It is not a sign of weakness to go and see your practitioner and say, look, I am at the point where I am almost debilitated. I'm so anxious when I go to clinical, I don't know what to do with myself, okay? Or I am so depressed. I love nursing school, but man, I have a very hard time getting up in the morning, okay? It is so important for you to get that taken care of. That is part of the self-care. That is part of saying, I am important, okay? Because you are. All right. So if you're sitting here telling your brain with the depression or the anxiety or the ADD, you're not important, I'm not taking care of you, then what is that going to do for your academics? There's no way, y'all. So please go talk to your practitioner, go talk to your school, get the modifications that you need. If you need extra test taking time, they can usually do that. If you need to be in a room where you don't hear every single person smacking their gum, coughing, going through an exam in like 41 minutes when you're on question like 8 and you're like, okay, you may need some modifications, and that's okay to go and do that. That is so super important. Please, please go do that. It does not mean you're weak. It means that you put yourself as important and you're telling yourself you are important enough for me to address these issues and to give me the best chance I can at making excellent grades in nursing school. Okay? All right. So with that said, all right, so we talked about getting sleep, we talked about eating, taking care of yourself, treating any kind of underlying conditions you have going on, okay? I just want to make a comment really quick because I see Brittany said in here about getting her depression treated and how she saw a huge boost in her academics. Girl, I absolutely applaud you. People don't talk about depression that much, and they don't really think how much it can affect their academics and how much it can affect their grades. So I am proud of you. You put yourself as important, and that is amazing, and I'm so glad that you saw the boost in your academics and your test grades kind of followed that. That's amazing, and that's a good testimony for you guys to see how important that you are. okay? The next thing I want to talk about, this is sort of like crunchy granola-ish, so if you're not this kind of person, just bear with me for a second. But I want to talk really quickly about the role of essential oils. Weird. I never thought I would be this person, but y'all, I am this person, okay? My son is almost 9. And he suffers terribly from ADHD. He is a wonderful kid. He is brilliant. He is a gifted child, but it is very hard for him to sit down and focus on academics. So I started doing some research that's evidence-based. I never was that super crunchy granola-ish sort of person where it's like, oh, smell the oils and they'll heal you. I wasn't that person, but you can't lie. You can't blind yourself to scientific evidence and evidence-based things. So do I think that essential oils cure everything in the history of all time? I don't. Do I think they're a great adjunct and can help you? Absolutely. All right. So I want to just quickly run through some of the biggest ones that you could use in order to help you in your studying a little bit. Okay, so I think as Crystal in here said, Bath & Body Works stress cream and focus cream help. I haven't seen those, but it's probably that they have some of those essential oils in there that can help. So if you guys are into that, you can either diffuse it, you can put it in some a carrier oil like coconut oil or something. You can put it here before you go into an exam and smell it. As soon as you smell it, that sends this signal to your brain, right? Because smells are highly associated with things. You smell cookies in here today, and everybody's going to want to be eating cookies, right? Because that's the smell is highly connected to your brain. So when you smell these different kinds of things, it's activating different parts of your brain, all right? So with my son, while he is studying, I have a little diffuser, and I put peppermint oil. Now, really quick, I don't sell any of this stuff, so I'm not trying to sell you anything, but I'm telling you, it's really important that you get organic oils. You get things that are tested, things that are FDA approved, things that have been, do not get a low quality kind of oil, all right? You can find people that sell these all over the place, all right? But just make sure it's a high quality. So peppermint, diffuse that while you're studying, put it on before you go into your exam. That can help to increase your studying, your memory, your retention, okay? So that's an awesome oil to use, okay? Jennifer, you made a really good point. So you said be mindful of others and use mildly around others because some people are disrupted by oils. That is true. So if you're going to go in and you're close next to somebody, do use it sparingly or just maybe do a whiff of it before you go in. Also, pregnant people get pretty mad at you and they can smell weird smells. So do be mindful of other people. I agree with that. So if you're studying, having a diffuser or putting peppermint on is a good choice. If you have ADD or ADHD or you have a really hard time settling your mind down, cedarwood is a really good choice, and vetiver is the other one that we like to use. And I'm going to put all of these in a separate post and all these kind of strategies and things so you guys don't have to write down every single thing that I'm saying right now. But those are good oils to use. So the vetiver goes on the bottom of your toe, and you do that before nighttime because it is kind of soothing and it kind of helps you to focus. And then the cedarwood you're going to put on the bottom of the feet too. Both of those smell terrible. So if you're like, I don't know, if you're crushing on somebody in your class, it's probably not best to wear to class because you'll smell like an old lady. Okay. Okay, Lisa said that lime and eucalyptus are her favorites. Yes, those are fantastic too. And then Crystal Stevens asked, how is it spelled? The vetiver is V-E-T-I-V-E-R. It's vetiver. And then there's cedarwood is the other one, and then peppermint. Those are the three biggest ones I would recommend to just kind of chill you out a little bit, help you to focus, and help you to retain, to learn things a little bit better. Those are all good options. All right, and that's all I'm going to say about that. All right. I just want to throw that in because those have helped my son greatly. It's not the only thing that we use to help, but it's definitely something that you guys can use in order to help. And it keeps you awake too. I made a body wash the other day because once I got into essential oils, I got really weird and crunchy. And so I made my own body wash and it has peppermint in it. So now when I go take a shower, I'm like, and I'm awake for like 422 years. It's also the coffee too, probably helped, but all right. Okay, so those are all kind of the things leading up to the actual test taking strategies. So now, Wendy. Oh, hi, Wendy. Welcome and join us. So Wendy says, take the bottle with you to class and sniff it, which is good. I mean, people will probably think you're the weird chick in the class, like, but I don't care. I probably am the weird girl in class, so I was fine with that. But it really does help. So if you're worried about how other people are smelling you, then you can just take it to class and just, take a hit in there before you go in of your essential oils. All right. Okay, so with all that said, and that's kind of prepping you for the actual exam portion. So now let's talk some test taking strategies for the exam. there are a couple of things I kind of want to go over about how people test take and how they learn. And this can really help you on your exams. Okay. Alicia said in Texas, they won't allow you to take items into the testing center. That's true, but you could do it out in your car before you got there. Or you could do it, before you enter the testing center. So that way your brain's kind of ready for all of that. That's a good point. All right. So let's talk a couple of things, and let's talk about how your brain sort of works when you're on these test taking things. So probably one of the biggest advice pieces I could give to you guys when you're test taking is do not look at your answers. Okay. And here's the reason why. What happens is our brains are trained to associate two things together. All right. So if I say hot, most people say cold. If I say mother, most people say father. That's how we learn since we were infants. That's how we learn, is we associate two different things together, right? Well, the problem with that is when you're on an exam and you have a concept that they're testing you on and you see something in the answers that looks familiar. Oh my gosh, it's two things that are together and I'm going to pick it because those are associated and those go together. For instance, if your brain is looking at the exam and you're kind of scanning the question, okay? So we scan the question, you see something about Lasix, all right? You guys tell me. What is the first thing that comes to mind when you think Lasix? The drug, not the eye thing, because people have answered the eye thing. What's the first thing that comes to mind when you guys, when you hear the word Lasix or you see Lasix in an exam question? What are you thinking? And there's a delay, so I'm going to wait for just a second so people kind of start answering. Okay. All right. Carolyn says retention. Okay. Potassium. That's from Shay. Christy says a diuretic. All right. Lisa says edema. Ashlyn says fluid. Agreed. Crystal, diuretic. All right. So as soon as we see Lasix, all right, we think, oh my gosh, watch their potassium, and oh my gosh, watch their urine output, and make sure you give it in the morning, and don't give it too fast IV push. And your mind is racing for all these things because y'all, you are excited that you know something. And so when your brain gets excited, oh my gosh, I recognize a drug, it's going to want to pick the first most familiar thing you can find. So if you're scanning the answer to potassium, one of the answers says potassium, and you're going to pick it, and it has nothing to do with what the question is asking you. All you did was associate Lasix with potassium. And you tried to put those two together, but it didn't make sense because that's not what the question was asking. The biggest thing you need to look at on test taking is, what is this question asking me? And I know y'all know what I mean because you've read some nursing questions before and you read it about 82 times and you're still like, what are they saying? Right? Like just the way that it's worded or something and you're like, I don't get you. What is it saying? So the very first step in test taking is, one, do not look at the answers, okay? Because the answers will bias you. Once your brain picks one of these answers, okay, it's very hard to talk it out of it, all right? And you'll see this is why sometimes people will change their answers at the very end because your brain has picked something and then you're trying to talk yourself out of it, okay? Do not look at the answers. The answers will bias you. Okay. And the reason I say to find out what the question is asking, because here's what you guys will do on exam sometimes. All right. So let's say you come into our office today. All right. And I say, oh, hi, my name is Amber Brown. What is your name? And you say, oh, hi, I go to nursing school. I say, oh, well, that's great because we're a nursing school where we tutor for nursing students. That's great. But what is your name? And you say, I go to UTMB nursing school. Again, cool. And I'm glad to have you here. We have lots of students from UTMB, but what is your name? I'm having a hard time with test taking skills. And at this point, I'm like, is there something wrong with her? Okay. Because you're telling me all things that are true. All right. But it's not answering what the question is asking. Okay. So you have to be answering what the question is asking. And you can see at the end of the question what that question is asking, whether it be priority, which would you call the healthcare provider for first? Which of the following would you notify the healthcare provider for? What is the most therapeutic response? So if you don't understand what they're asking, it's going to be very unlikely that you're going to choose the right answer to answer that question. Okay? That's like if you guys came in today and I said, tell me the answer. And you say that. The answer to what? Just tell it to me. But you didn't give me a question. You have to understand what the question's asking. All right. And with that said, I want to talk to you guys about priorities, okay? Because when they say, what is your nursing priority? Well, that's clear as day. They're asking me a priority question, right? But if they say, what's the first thing that you would do? What does priority mean? When you guys see what's your nursing priority or what's the first thing that you would do, what does that mean to you? How do you answer those questions? What is that asking you and why? There's a delay, so I'm going to wait for you guys to kind of start answering. What does the priority mean? You guys will get tons of questions like this. Why? Because we don't want you to kill anyone, right? All right, so Lisa says it's our initial action. Why is it our initial action? Why is this the very first thing that we would do? Sandra said it's an action. Carolyn says it's skills. What's going on to keep my patient alive? Jessica, that is it right there. When they ask you priority or what would you do first, that is the action you are taking to make sure your patient doesn't die. That is the action you take to keep your patient alive. So it is, what of these following things am I going to do to save my patient's life? So it very well could be that all 4 answers are great. They're therapeutic actions that you would give, but they're not what's going to save your patient's life right now. All right. So with that said, I'm going to switch the camera around. We're going to go up to the board. All right. And I'm going to teach you how to do priority questions. There's a priority chart that we use. There's lots of different ways of thinking on this. You'll see decision trees and you'll see all these different things. We want to keep it as simple as possible. Okay, so I did write a question for you guys, but I think I want to kind of show you what the priority chart's going to look like too. All right, I did not write answers on the board because I don't want you to look at the answers. Stop looking at the answers before you look at the question. All right, so whenever I flip this around, it's going to seem like we lose the feed, but we didn't. So just bear with me. It'll freeze for a second, and we're going to go up and I'm going to teach you guys the priority chart that we use that will help you to master priority questions every single time. Okay. Hey, Katie, there is, I'm turning it around right now, okay? Okay, so you guys won't be able to see me for a second while I get this set up, so just bear with me. But this is the question that I wrote for you guys. Say this one's actually a pretty easy question, all right? So I wanted to start off, let's give you some confidence. Let's build it on up, okay? So this is the question that we are going with, all right? I wrote this one, and like I said, I did not put answers on it for a reason, because I don't want you to go straight to the answers. If most of you guys were watching this and you saw blah, 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 okay, you have a client, he's got COPD, okay, oxygen, sit him upright, tripod. Your brain is already thinking all these different things, right? But we want to slow that process down a little bit and just stick with the question. So let's talk about what this question is asking, okay? So if you look at this, this says a 68-year-old client is admitted for pneumonia with a history of COPD. Which of the following would you call the healthcare provider for immediately? Y'all, these are one of my favorite questions because I'm going to make fun of people for a second, but not in a sort of mean way. Okay, when you see what would you call the healthcare provider for immediately, you need to picture yourself picking up the telephone, calling the doctor in the middle of the night. It's 4 o'clock in the morning. All right, the doctor you're calling, she's got 2 other kids in the bed with her. She's been up all night long. She's exhausted. You're calling her and you say, "Doctor, come quickly. The patient has a mild rash." Y'all, that's not it. So if you can picture yourself calling the physician and it's something ridiculous and you would feel like, okay, she's going to murder me when she gets here, that's not what you call the healthcare provider for immediately. That word immediately tells me there is something that is wrong with my patient that I cannot fix, that I need a doctor's order in order to fix something that's broken in my patient, okay? So when you look at this, this is actually a priority question, right? It's asking which one of these things is going to be the biggest, scariest thing that you need a doctor's order that you can't fix, that there's nothing that you can do at the bedside. This is something I need to call the doctor for immediately and have them run down the hallway. I would not call and say, "Doctor, come quickly. The patient has some mildly decreased urine output." Patient, or "Doctor, come quickly. The patient has a moderate headache." Well, shoot, I have a headache now because you called me for this kind of stuff, okay? So you need to picture yourself calling the healthcare provider. And if it is not something that they need to be running for, that is not your answer. Do y'all hear me? Okay. So, with that said, let's take a look at this. So I'm going to talk to you about how to do this priority chart. Okay. This is going to sound bad whenever I put it up here, okay? But the reason, please bear with me because it is beautiful and it works every time. So, nothing complicated. Anytime I see something that's going to be a priority, I quickly am going to either draw this, if they let you have a whiteboard or a piece of paper. If they don't, you're going to have to learn to do this in your head. I'm dividing this into 3 sections, okay? The first section is, I'm going to do WCS here. That's worst case scenario. What is the worst thing that could possibly happen to my patient if I did not report this or if I did not do this, okay? Will it kill my patient? So will this worst case scenario kill my patient? That's just a yes or a no, a check or an X, and that's it, okay? If it will kill my patient, how fast will it kill my patient? So what I put over here is either seconds, minutes, hours, days, weeks, months, years, depending on how long that would take you to kill your patient. For instance, if this said our worst case scenario for something was malnutrition, malnutrition can take months to really kill someone. So could it kill my patient? Yeah. How fast? That would take months, okay? And so for each of your answers, you're going to fill this out. If you get to the end and only one of them could kill your patient, that's your priority, okay? If you get to the end and you have several of these or all of them that could kill your patient, but here you have months, you have hours, you have days, you have minutes, then you pick the fastest one that could kill your patient and that's your go-to. Do y'all see what I mean? It is that simple and that easy, and that is how we do priority questions. So we're going to practice on this one here. Now, before I look at the answers, I'm going to break down this question as much as I possibly can. All right? So let's take a look and see what they gave us. Now, most people like to say, okay, I've got some keywords here. You guys tell me, looking at this question, what you think your keywords would be for this question and kind of pick out what's important and what's not important. So y'all tell me what you think. Most people, if you're asking, will probably say, all right, Shauna says, yep, pneumonia. That's a big deal. They got admitted for pneumonia. That's a keyword. Okay. COPD. Well, I didn't have to put this, right? I added this in with the history of COPD. If this was just a 68-year-old client with pneumonia, okay. I mean, this could be a perfectly healthy client. This could be, I don't know. There's a lot of options, so I'm not going to read into it. I would just say, all right, this, poor older clients, happen to get a pneumonia. That happens sometimes with elderly clients, and it would just end there. But they put with the history of COPD. Y'all have to learn to break down these questions ridiculously. Every word means something. Why did they put a history of COPD? What does that tell me? This client is probably in somewhat of poor health. We already know that they have breathing issues. We know that their lungs and alveoli fill with fluid, which puts them at risk for pneumonia. So this client probably can't breathe, right? How would I anticipate this client looks when they come in? And what would I anticipate their assessment to look like, knowing that they have pneumonia and they have a history of COPD? What would that look like? You guys tell me. If I walked into this client's room right now and they were stable, okay, and I'm doing a physical assessment on this client, knowing that they have pneumonia and COPD, what am I going to expect to see on that client? And I don't mean that it has to be normal. What I mean is it's like a normal, abnormal, what you would expect to see. All right, Tesla says tripod position. Absolutely, I agree with that. So they are probably going to be tripoded themselves, right? That's just kind of like a normal thing I would expect. Now, I wouldn't expect that from every client, okay? But I would expect it from a COPD patient, okay? Shauna says they may have a hard time breathing. I agree. So they may have a little bit of dyspnea. Now, Deborah said, oh, hi, Deb. We love Deb here. Deb said low O2 sat. So in this client, because they have a history of COPD, I probably would expect their SpO2 to be a little bit lower. I'd probably expect them to be in the 90s. Now, if I took history of COPD out
and I said, this client is just admitted for pneumonia, and then their SpO2 is 91, I'm like, ooh, this guy is not doing well, and I'm really nervous. If I said, oh, this client is admitted for pneumonia and they have a history of COPD with a 91%, I'm like, nah. You know, I mean, they normally run kind of low. Do I love it? No. Am I running to call the physician? Excuse me, Dr. Jones. Yes, the patient with COPD has a 91% SpO2 stat. Yeah, that's pretty much their normal, and then they're going to yell at you and scream at you and call you bad names, okay? So this makes a huge difference, and most people just kind of be like, oh, pneumonia, history of COPD, and you can't just glaze by things. These words are in here for a reason. This is a 68-year-old client, so we know it's kind of an elderly client. What do you know about elderly clients? What's one of the things that can happen whenever they get an infection? What's one of the first things that we see? Confusion, right? So if they get a UTI or they get pneumonia, sometimes they can be a little bit confused, right? So am I going to run to the physician because the patient shows some mild confusion that kind of comes and goes? No. Now, if the client was a 21-year-old client who was here for pneumonia and they all of a sudden have new onset confusion, I'm like, oh, this patient probably hypoxic, we are not looking good. So age makes a difference. If they give you an age, it's for a reason. All right, so I know I have an elderly client, he's got pneumonia, he's got a history of COPD. Now, which of the following would I notify the healthcare provider for immediately? Now, you guys, when you are not looking at the answers, okay, I want you guys to tell me what are some things that you, as the nurse, would notify the healthcare provider for immediately, not even knowing the answers. What would you be like, man, okay, let me think. The patient has an active infection. They have COPD, so they're probably tripoded. They probably have some dyspnea, probably have a low SpO2. That's kind of normal. Now, when I listen to them, I probably would expect to hear what? Some crackles in the bases. They got pneumonia. They have COPD. That's pretty normal all the time. I'm not running to call anybody at this point, right? Okay? So what would you get nervous about? All right, Megan says labored breathing that's not going away. Yes, so if they are really truly dyspneic and it's not going away and we're giving them a small amount of oxygen, all right. We have a change in level of consciousness. All right, so if we all of a sudden have new onset, change in level of consciousness when the patient's already being treated, I might get a little nervous about that. All right, Tesla says true cyanosis. Now, would we expect cyanosis in our patient that has COPD? No. And y'all watch out for that word on tests, expect. If they give you a word expect to see, then that means across the board on every client that ever comes in with pneumonia and COPD, they're all going to be cyanotic. No, God, I hope not. So I would not expect to see true, like, you know, cyanosis, like actual cyano, like they're blue. I wouldn't expect to see that. I would expect to see crackles in the bases. So let's say this said crackles in bilateral lung bases. Do I like it? Do I love it? I don't love it. Is it kind of expected on my patient because of the history? Yeah. All right. What if this said a white blood cell count of 21? What do you guys think about white blood cell count of 21? What do you guys think? White blood cell count of 21. It doesn't tell me what stage of pneumonia that they're in. I don't know that I would call the physician immediately for this because I do know that they have an active infection. Now watch me change this. All I would have to do as an instructor to change the entire answer of this question is to say, on day 4 of antibiotics. Now, would that change your answer? Because if my patient was on day 4 of antibiotics, and all of a sudden I had a white blood cell count of 21, our white blood cell count should have come down pretty significantly by day 4 of antibiotics. So that's something I may have gotten a little fussy about had I known they were on antibiotics for a period of time. But they don't tell us that in this one, right? All they say is the patient has pneumonia. Okay, well, that's all they give us. They don't say at what stage in treatment. So would I expect a high white blood cell count with pneumonia? Absolutely. So I'm not running at this point. I don't like it, but it's kind of like an expected abnormal. Okay? Okay. How about, what if I put SpO2 of 92% on 2 liters of O2? Are we running? Is this the first thing that you would do? What do you guys think? Can I increase the oxygen? No, because we know that once you have a patient that has COPD, we can't increase the oxygen past 2 liters, right? It shuts off their respiratory drive and they no longer will breathe. So that's the highest I can go. 92 on 2 liters is okay for a client that has an active infection with a history of COPD. I'm not running yet, all right? Let's add some more just for fun, okay? I want to see what you guys think. All right, let's do some E, some F, and some G. Okay, so let's say, what if this said a fever of 100.3? All right, what would you say about fever of 100.3? What y'all feeling? All right, Claudia says cinnamon high Fowlers. Absolutely. Yes, we're going to do that. And if they were already tripoded, which this you'll see an answer a lot on exams that says patient is in tripod position. Good for them. I love that. I'm glad about that. I definitely wouldn't call the physician for that. Can you imagine calling a doctor in the middle of the night and be like, doctor, come quickly. The patient is in tripod position. Y'all know, or you should know, that in nursing school, the more respiratory distress your patient is in, the higher we want them up. So if they're not in respiratory distress at all, leave them in semi-Fowlers. I'm fine with that. If the patient's in acute respiratory distress, asthma, acute COPD exacerbation, sit them in high Fowlers. They should be up all the way. That helps a little bit with lung expansion, helps them to breathe better. If they're in severe exacerbation, like I'm struggling, I'm going to lean over in tripod position, whether it's asthma, COPD, what have you, because that's going to allow my lungs to expand even more because I'm leaned over. So am I calling the doctor because the patient's in tripod position? No, I'm patting myself on the back like, good job, girl. You positioned them correctly. Okay? How do we feel about this fever 100.3? Okay, so some people said it's expected, not worth a phone call to an MD, all right? So fever of 100.3 is not even considered a fever. So for NCLEX purposes and most nursing school purposes, 100.4 is our threshold. So this, I'm good with this. It doesn't tell me at what stage of pneumonia I'm in. It doesn't tell me if I've had antibiotics. So fever 100.3, you rocking it. Your body's heating up enough to kill that bacteria. I'd again be like, pat your body on the back and say, good job for heating up and killing the bacteria. I'm still not nervous about anything yet. Okay? What if this said, patient has pink frothy sputum? How do you guys feel about that one? The patient has pink frothy sputum. How do we feel? What y'all thinking? Crystal says, yes, call. Y'all give me a rationale and tell me why you feel like this one would be like dum-da-da-dum. Lisa said bingo. I love that. Deborah said yes. All right, y'all tell me why. Ashlyn says, not good. Y'all tell me why the pink frothy sputum would cue you in like, ooh, we not feeling so good. Why? Everybody's telling me this is bad. Okay, but why is it bad? And tell me, what is it? Oh, Crystal, ding, pulmonary edema. So that means that this patient is having such a huge inflammatory response. We have had a rush of blood flow to the lungs. The lungs have had increased capillary permeability. We're leaking into the third space of the lungs, which is the alveoli. And now we've got pulmonary edema. That's going to give us pulmonary hypertension. We're in trouble. Now, this would be worth a call to the doctor and be like, oh, you need to come pretty soon because this patient's probably going to completely crunk out on us very shortly from now because their lungs are completely filling up with fluid. We've got pulmonary hypertension, pulmonary edema. We're in some dire straits. Now I'm getting a little nervous. Are y'all with me? Now you start to see why that kind of makes sense. Okay? Let's take what we've done so far and put this on our priority chart and see if this makes sense. Okay? So let's say, all right. So if I wasn't sure and I really didn't know, I put it on a priority chart and say, well, okay, let's figure it out. 1, 2, 4, 5, we've got 6. All right. Let's start with A. What's the worst case scenario if I have crackles in bilateral lung bases? What does that mean? Well, I've got fluid in my lungs. So the worst case scenario of that would be poor gas exchange, right? Alveoli is the site of gas exchange. So this would be poor gas exchange. And that would really end up meaning like hypoxia, right? Because if we can't gas exchange, it would either be hypoxia or hypercapnia, right? Could that kill my patient? Yes. Now, if you just see the word hypoxia, people get real nervous and they're like, hypoxia, that could kill your patient so fast. Well, not really, okay? Because if you think of it in terms of what your patient looks like, patients with COPD have hypoxia all the time, which is why their red blood cells never stop turning off, right? We constantly get erythropoietin made, which is why they end up with polycythemia, yeah? So, how long would it take hypoxia to kill my COPD patient? Girl, we're looking at probably months, because this is how they live, right? They live with crackles in the lung bases. Their body just kind of compensates for that. So how long would it take for hypoxia in poor gas exchange to truly get to the point where it killed my patient? We're looking at months, right? Does that make sense? All right, white blood cell count of 21. What's the worst case scenario? All right, worst case scenario is they have an infection. And let's say that infection isn't responding, all right? So that infection could end up leading to sepsis, right? So worst case scenario would be infection sepsis. Can that kill my patient? Yeah. And how fast could that kill my patient? How long does it take sepsis to kill someone? A couple of days, right? So we could say probably 2 to 3 days before the patient would truly die of sepsis if we're trying to fix it, right? All right, if we look at C, SpO2, 92% on 2 liters of O2. Well, look at this one, y'all. This one, again, is basically saying hypoxia. And I want to give you a good, fun fact for test taking. If you have 2 things or 2 answers on the exam that are too close or that are basically testing and saying the same thing, they're both wrong. All right? Let me show you a really quick for instance on what I'm talking about. Sometimes they will say, all right, and y'all, it really doesn't even matter what the question is. Let's say you have a patient that comes into the emergency room, okay? And I would say, which of the following will you treat first? Okay? All right, so let's say we have a patient that goes into the ER, right? Is this making sense so far, what I'm saying? And let's just say they asked you, let me ask it a different way. Let's say they ask you which lab would you draw first. And they say A, and you got A, B, C, and D. Okay, so let's say here this says draw CBC. This one says draw an H&H. This one says you need to draw a platelet level to make sure that they're not bleeding. And this one says you need to draw a comprehensive metabolic panel. Y'all, if you look at that, and that's just a really easy example, but if you look at that, y'all, what is included in a CBC? An H&H and platelet counts. So if this is saying the same thing as this, is saying the same thing as this, well, I can't just pick one. They would all have to be, right? So if it's basically saying the same thing, then they're all wrong, and that would only leave me with the CMP, and I don't care what the question is. Does that make sense? Okay, so always be looking for things that are basically testing the same thing. And if we look in this question, we're again on hypoxia. Well, we already talked about this. Could it kill my patient? Yeah. How long would it take in this patient? Months. And since these are basically asking the same thing, I would rule both of these out. Okay? D, fever of 100.3. Well, even if I was getting fever up there, that's basically saying my worst case scenario is, infection. Worst case scenario of infection would be sepsis. Well, look, we just did it again. Infection, sepsis. They're basically testing you on the same thing. White blood cell count. Test infection. If we have a high fever, that tells us we probably have infection. Could that kill my patient? Yes. How long would that take? 2 to 3 days. Doesn't really matter. Why? Because if they're testing the exact same thing and they're basically saying the same thing, they're both wrong. Okay, so we've already ruled out A through D. The patient is in tripod position. What's the worst case scenario if the patient wasn't in tripod position? They would be uncomfortable. They may have a little trouble breathing. Let's take it to the extreme and say worst case scenario would be dyspnea. Can you really die of being short of breath? No, you would have to end up taking it even further and saying hypoxia, which I think is stretching. But even if we did, let's take it to hypoxia. We already have hypoxia on here, okay? If it's basically saying the same thing, it's gone too. The only thing that leaves us with is the pink frothy sputum. So even if you really don't know much at all, does this make sense? Yes? Yes? No? Maybe so. So that's how the priority chart works. So when you get to the end, you're going to say, which of these could kill my patient? And then which of them could kill my patient the fastest? So in this case scenario, patient has pink frothy sputum, we're not getting gas exchange, the patient's got pulmonary edema, pulmonary hypertension. Can that kill my patient? Yes. How quickly? Probably within the day. All right, so since that one would be the fastest, I would choose that one. Does the priority chart make sense? All right. You can use this every single time and it works like a charm, but you have to practice it, okay? And you have to start to get comfortable with how fast it takes you and take into consideration what's going on with your patient, all right? I'm gonna leave you with one other thing before I go. This is gonna really step on some people's toes and hurt some people's feelings, but you guys are gonna have to let go of the ABCs because they don't always work, okay? Is airway important? Yeah. Is breathing important? Yes. But you have to take into consideration what's going on with your patient at the time. For instance, if a patient falls into a pool, you guys have read stories about this before. They were pulled out of the pool 10, 15 minutes later, they still were revived and they still lived and they had normal lives after that. So you can go hypoxic for a good period of time, right, before you will die. If a patient has a femoral artery slice, okay, let's say we're in cardiac cath, we hit something, they're going to die of the bleed before they would die of hypoxia. So don't let the breathing thing and the airway thing cloud your judgment. You have to use priorities and think which one of these is going to kill my patient the fastest. Because what I've seen tons and tons of students come in and say is, I did the ABCs and it didn't work. It doesn't always work because you really have to look at your question and you have to see what's going on with your patient and put yourself in that scenario. All right? I could go on with this for about 700 more years, so I'm going to go ahead and stop for today because I'm excited and I can tell my face is really hot. So I'm going to go for today. I've given you guys a lot of information. We are going to post another event today. We've got another live free event coming up next week where we're going to do kind of the same thing we did today, but we're going to be tackling select all that apply. And then if there's anything else you guys really want to go over as far as test taking, since it's a two-parter, you can either email us, you can message us, you can write on the Facebook page and just kind of let us know, hey, I really want to hit on this, or I want your opinion on this, and we can touch on that and answer some questions before we get started for next week. All right? This was so super fun, and I want to thank you guys for joining in with us today. Make sure you're joining in with us next week too, because we'd love to have you back. If you have any questions, comments, concerns, you want to yell at us, that's fine too. Just join us back because this is how we teach every single time. We like to have fun with it. We like to pick your brains. So please come back and join us next week, and you guys have an awesome week. Y'all take care.